Good afternoon. It is Tuesday, February the 2nd, 2021. Sagal, David Lahashu Juts, and welcome to today's COVID-19 Task Force update on this, our 173rd show. Today we have a guest coming in for an update. It's Natalie, the Executive Director of StepByStep. We'll also be joining via Zoom Alana, Kane, Support Counselor for KSCS, and Merrick, Diabo from the Education Center. And also we'll be hearing from Lisa Westaway, Executive Director of the KMHC. And here's our first guest, Natalie.
Gwegwe, everyone. I'm Natalie, Executive Director of StepByStep Child and Family Center. And I'm here today to advise you that one of our staff members has tested positive for COVID-19. I just wanted to come on to Facebook today, Facebook Live, to assure the community that all the precautions have been taken, that public health has contacted us and everybody in the building. The children are safe. The children have not been, are not said to be at risk. So we have followed all the measures since the beginning. It's going on 11 months now. We have in place the staff wearing the PPE. So they're wearing the visors, the goggles, the masks. So we knew all along that the potential of being infected is a possibility within our community, and we have seen that. So having a positive case is not easy. It is worrisome for the individuals as well as possibly parents and the staff. But I'm here again to assure you that the contact tracing is being taken care of. Public health is doing everything they need to, and that the children are not at any risk, do not need to isolate. So there is a press release that will be going out. As well, all of the parents have been contacted via class tag to let them know. We will continue to remain vigilant. We will continue all of the social distancing, masking, and PPE. But as you know, we don't social distance from the children. And I just wanted to come on today to say Nyawagoa to everyone, and our hearts go out to everyone who has been infected with the virus, and especially our staff member. It's difficult during these times, but together as a community, we will get through this, and I'd like to thank you for entrusting us with your children. Nyawagoa.
Nyawa, Natalie. Our next guests, as I mentioned earlier, are going to be joining us by Zoom today, and they're going to be talking about a very, very important subject today, and that's mental health issues that affect our young people and our adolescents, especially during these extremely difficult times. So I'm going to hand it over right now to Alana Kane and to Merrick Diabo.
Hi. Thank you so much for that introduction, and we definitely appreciate how many times you said it was very, very important.
Sorry, we're having some technical difficulties right now. We're going to try and resolve them. Welcome to live TV. So once again, we join Merrick, Diabo, and Alana Kane to discuss some of the issues facing our youth and mental illness.
David. So we're back. So as David mentioned, my name is Alana Kane and I'm a support counselor at KSCS. And we wanted to come here today on Kahnawà 911 to discuss a very important topic indeed. We know that thankfully mental health has been addressed recently at Kahnawà 911 and everywhere else. I think people are talking about it, which is fantastic. But our specific why we wanted to be here today was to talk about the youth, more specifically our teenager population. So as a support counselor, I have quite a few teenagers, youth on my caseload, and I was starting to notice some trends. I was starting to see some similarities between the people that I was seeing, and I wanted to reach out to Merrick at KSS, at Kahnawà Survival School, just to see, kind of get a feeling, were they also seeing the same thing? And indeed, once we connected, we saw that really they are experiencing similar. I mean, we share, the same clientele, but again, it was important for us to talk about that. So some of the trends that we were seeing, as we know, especially students who are attending KSS right now, are pretty much completely online. So they're doing their online learning, which can really be a struggle for teens. It's just the truth. We know that it's necessary at this time, but we also know that it's a real struggle for them. If you can remember being a teen, if you can kind of think back a little bit, just how important your peer support group is. Your friends are kind of everything. Your school, you go to school, perhaps you're in a sport, maybe you're in a club, and it really does make up most of your identity. And right now, these young people are kind of stripped. They're stripped of that. They can't really hang out with their friends. They're not able to get that outlet, whether it's through sport or some kind of other club. So they're not getting a lot of social interaction in that way, and it's really, taking a big toll on them. And so I had seen things where, students are not signing in to class necessarily. They're very withdrawn. They're having a hard time connecting with family members. They might be staying in their room a lot. They're staying up all hours of the night on various devices, their phone, streaming devices, Xbox, that kind of stuff. And which, sometimes people could be like, oh, it's just teens, but we're really seeing something quite exceptional this year. And so we wanted to come and talk about it. So Merrick, we kind of chatted a little bit, and from your perspective, what have you also been seeing?
Well, thanks, Alana. I think you hit the nail on the head in terms of where we're at in the world with COVID, and specifically when we're talking about our kids. And I know, speaking with people, friends, family outside the community, they're not where we're at as a community right now, because our students have gone into remote learning for at least at the high school level. So there's three main things you had talked about trends and similarities that you and I were having with people, young people that we're meeting. So for me at Survival School as a social counselor, I also have my coworker, my peer, Leo Perron, and there's an amazing team. Not to mention the teachers, just all the staff overall at KSS. We're all trying to do our part. And we're recognizing that there are these trends that are happening, more so for me and for Leo, seeing these trends. And Alana, you and I were talking about this, that what we see more often than not, we're seeing heightened anxieties. We're seeing a lot of isolation. And I think on a broader scope of things, poor stress management. And the thing is with anxiety, as most of us are aware of, there's good anxieties and there's bad anxieties. So of course the good anxiety is before a sport event, like you're going to play a football game or a baseball game, and you're a little bit nervous about the game, but that anxiety is actually going to help you perform in that sport. And then of course we have the negative anxieties that are being, and that's of course you're preparing for a test, And when you get into that exam, into that test, you buckle under the pressure. That's that negative anxiety. So we know globally, this has been talked about all over the place. You've heard it. Bell has their campaign, Let's Talk Bell. We know that mental health is at the forefront right now. So anxiety has also increased globally. And of course, with COVID-19 and the measures that are in place, we know that this isn't helping. And I know Alana and I wanted to come on and candid of where we're at. We didn't want to hold back anything. For me, for survival school, and I know with Alana, with her clients, mental health is at a crucial point with our youth population. And I'm being specific to youth because this is the trends that both Alana and I are seeing with the young people that we are working with. So Alana, with you, when you talk to some of the youth that you are speaking with, isolation is one of those things that you tend to see happening with them as well, right? So there is the anxiety, and there's of course, coping mechanisms with that, but the isolation, what are you dealing with? What are you seeing?
Yeah, exactly. So like I mentioned, it's mostly, I'm seeing a lot of kids who are just, socially isolated. They're staying in their room. They're not even necessarily interacting with family, which we understand. We're here today. We recognize parents are doing their absolute best. This is a completely different situation that no one could have ever expected. And we know that sometimes parents are juggling multiple children, different ages, and it's difficult. But we're just asking parents right now to kind of check in with your youth. If this is something that you're noticing, if you're kind of like, yes, they're a teen. Yes, they've never really wanted to kind of come out and chat with me anyway, but this is different. This is them really, disconnecting. They're not being part of family. Maybe they're not even coming to dinner, family dinners. And so it's just the idea of, we wanted to talk about it and just be honest about it. And just so that that we know that this is happening, and that it's not just you, it's not just your family, it's not just your youth, and that there is reason to be concerned. If you are seeing that your kid has changed drastically, to please reach out. To us to create opportunities for connection, whether it's movie nights with family, trying to create opportunities for them to safely, following all guidelines, it's either a friend. Then we're asking that you do that, and to please reach out to KSCS in particular. You can call 450-6326-880 for intake, and then Merrick as well. You were saying that parents can definitely reach out to you specifically if their child is at KSS.
Yeah, for sure. Our number at the school, it's 450-632-8831. And just to kind of touch a little bit more on the whole idea of isolation, Alana, I know just about every student that I'm speaking, this is one of the main issues of isolation. And you hit the nail on the head too, again, saying that it's important for parents, for guardians to really check in on their kid. I know, like, even in my own house, most of the time, everybody's off their own rooms and everybody's doing their own thing. But at the very least, there should be common time for your families to get together, whether dinner, that tends to be the prominent time, but minimize that time where your child is alone. Make those family engagement times. I was just explaining on the off screen with Alana that I just realized in my own household, what tends to happen here is hockey. Hockey's back on, and this is where we all congregate. And that's at least 3 times during a week. There's 3 games during a week, so we're watching the game. So that might not be for all families, but you need to make that time within your own household and connect, check in on them. And I think it's important. As parents, we try not to be vulnerable with our children and express how we're feeling about things because we want to remain strong for them. Well, especially in these times, this is actually the perfect time to open up to your kids to that you're feeling it as well. You're a little bit concerned, but just have that dialogue back and forth, and open up those lines of communication with children. Don't let your kids eat alone. Don't let them bring their plate into their room. Make that type of change in your environment. Because I know there are certain families, everybody's off to their own room, everybody eats dinner alone, but make that time, put that together at the very least. It's just one little nugget that you could take back into your own homes. And stress management definitely is a big portion. We were lucky at survival school. We had a guest speaker, Don Burnstick. He presented whole student population, and it was really profound. Some of the things that he taught to the students. And the thing I'm going to take is, he says there's 4 priorities that he's lived by. That was to give thanks, to share, to cry, and to laugh. And I thought these were really, really crucial points, and it's something I wanted to present half of Don Burnstick, to share with Kahnawà that it is important to give thanks. Give thanks for your family. Everybody's healthy. Everybody's together. Even, for the family of the individual who is sick from StepByStep, my heart goes out to you guys. Things are going to be good. Make sure you stay together as a family. That's just it, is that you should give thanks for that family. And also, of course, share what's going on with each other, cry, laugh, and that's all I got. Make sure you reach out to people. Don't be afraid to contact either one of us. We're there. We're in your corner. We're in your son or daughter's corner. We're here for you. Alana, any closing thoughts?
All I wanted to say real quick, this was just a really initial contact, but Merrick and I will be on the roundtable talks next Monday on Facebook Live. So we're going to talk way more about this. So that's what we got for today, but don't never be afraid to reach out.
Okay, great.
Thanks, Kahnawà.
Thank you very much, guys, for joining us. But before you go, can you please repeat your contact numbers again, just in case our listeners and viewers didn't hear it?
Yeah. So for me, you would contact intake at KSCS at 450-632-6880.
And for me at KSS, Kahnawà Survival School, that's 450-632-8831.
Okay, great. Nyawago for joining us. Really appreciate the time that you took to talk to our community today, and I'm sure we'll be hearing from you again soon. Nyawago.
No.
And once again, that was Merrick Diabo from KSCS, and also Alana Kane from KSCS. Sorry, I think I got those backwards. Kahnawà Education Center. Our next guest is Lisa Westaway. She's going to be providing you with some more information. And of course, Lisa is with the Academy Memorial Hospital Center. Lisa?
Thank you. And thanks for that presentation. I actually will be complementing that with some numbers so that you see some of the impacts to the community and to psychosocial services in general. So basically that's what today is about, is to present some stats, and many of you have been asking for these numbers for quite some time, and we have finally been able to compile them. So we wanted to be able to give you stats where we're at right now. So we weren't able to get this up on the screen, so I'm going to show it to you in this way to start. So, but in the future, you'll be seeing this document on a regular basis on the screen when we do our Facebook Lives. So as you see here, we have the total number of tests that we've done for COVID-19 at the testing site. So that's 2,873. And of that total, 98 have been positive since we've opened our testing site. So there may be some positives for people who were tested at other sites, but this is really for the site at the hospital. And so that's a 3.41% positivity rate, which is quite high. So as you recall, our positivity rate, we hope that it's at 2% in order to be fully feel confident regarding safety. This, of course, is a positivity rate over the whole course of the pandemic. And so it's not looking at the positivity rate right at this moment. In the first wave, we had 22 positives, the second wave 76, so we've had definitely a harder second wave, as we know, and 807 tests were performed in the first wave, 2,066 in the second. So we have had a lot of negative results, 2,775. I see that as positive because it means that people are coming in and being tested when they have symptoms, and I really encourage you to continue to do that. So we've broken it down, the stats down a little bit more. So on this first table, we're looking at male versus female. So in total, we've had 45 positive cases, male, and 53 female positive cases. And this is a breakdown by age group, so it's hard for you to see. You'll see it later when we put it on our page. But the highest numbers really of positive cases are between the ages of 10 and 59, and the highest positives are really between the 50 and 59 age category. So over here are our more vulnerable populations, 70 plus, and there have been very few cases, five actual cases that are 70 and over, and we're very grateful that they were healthy and are well, but very few cases. So it means that we're doing a really good job. We're protecting our community. Our positive cases are in the lower age ranges, which is a safer place to be, so we want to keep that up. If this next table shows us a little bit about how many tests we've done by month. So this last month here is 938 tests. That's January 2021. So we've definitely seen a high volume of testing, and this, I believe, includes screening as well. So we've had a large amount of testing and screening at the testing site in January, and again, just a thank you to the team that's there who have been working really, really hard, and thank you to you guys who are coming in with symptoms, because it's because of that that we're able to contain the virus as well as we have been able to. So speaking about numbers, I wanted to give a little bit more information about some of the actual impacts to community over the last almost 12 months. Well, we'll say 11 for now. But so police calls. These are really very specific by category, and it's something that we've been looking at and that we continue to monitor on a regular basis. These numbers actually help us in making our decisions, so I'll speak a little bit more about that at the end. So police calls, we're really comparing as of last March 31st, 2020, up until the 13th of January 2021. Police calls, and this is regarding aggression, theft, driving under the influence, substance abuse, conjugal violence, psychosocial or mental health calls, suicide attempts. All those calls combined have increased quite drastically over the past year. So as of last March 31st, we were at 909 calls, and we've increased to 1,489. Medical transport and ambulance calls have also been significantly impacted, but at this point they've actually decreased. So why is that? So we've gone from 1,237 calls to 951. Those numbers have decreased because people are afraid to call for an ambulance or afraid to go to their medical appointments. This has a significant impact on the health of the community in general, because either we're not going to important medical appointments that could be life-saving, or we're calling the ambulance when it's really at a more emergency state and a state that could sometimes put our life at risk. So again, just a bit of a message about that is to really continue to follow and go to your medical appointments. If they are happening, if they're scheduled, it's because it's safe to go. Our food bank services. So as you know, we've been offering support for food security. At last March 31st, 2020, we had 191 clients. That has gone up to 378 clients as of January 13th. Schools are also drastically impacted. We don't have exact numbers. However, we do know that there's been an impact to students who have had difficulty functioning in an online platform. So this will have an impact on students' academics, their learning ability, their socialization, their athletics. So we're still compiling numbers regarding school impacts, but we do know and we do see them that they're there. Financial support. So the numbers, we didn't provide financial support, or I don't have numbers about that as of last March. However, we do have, as of the 13th of January, and this was prior to our recent February 1st reopening of business, we had 630 clients. And that actually is 10% of our 18 and over population. So that's quite a significant number of people who were accessing the KERM. And as you know, this could have long-term impacts on feelings of empowerment, of being able to provide for family, feeling safe and secure. Again, all of these elements have some, I guess, impact on health and safety in our day-to-day lives. Health is not just about physical health, but there are many social determinants of health as well that these categories fall into. So we wanted to present these numbers to you because we do follow them, and we do have to take them into consideration when we're making overall decisions about closures or reopenings, and what the impacts could be on the community in the short term and in the long term. And that's why we always try to have the least amount of restrictions possible in order to be as safe as possible. And that's why you see sometimes that we fluctuate between openings and closures depending on the numbers that we have in the community around us, and depending on these impacts as well. And these numbers were very instrumental in our recent decisions to reopen business, to allow 2 household visitation, despite the fact that we're still at an elevated level of risk. So I hope that this is pertinent to you. We'll continue to present these numbers as we go along. Just to comment that as of today, we are at 5 active cases in the community. So there have been new cases identified today. And so we still want to make sure that you're aware that we have to remain vigilant, always masking distance, masking distance, hygiene, and really protecting those around you, your vulnerable population, as much as possible, while still providing all of that support that you need to provide. So check in on your family members, check in on your kids, on your youth, make sure that people are okay. And yes, it is okay to reach out for help. It's really important. And thank you to KSCS, who have been really, really very vocal lately. We have to talk about mental health. This can't be a taboo subject, and we've had a lot of airtime about it in the last little while. And it's because we want to make sure that the community knows that it's a safe place, that you can reach out for help when you need to. So thank you.
I'll go, Lisa. And just a point of clarification, in the graph that was displayed earlier, those stats were up until January the 31st. And that's it for our show today. I'd like to thank you for joining us here. And from all of us at the EOC and the task force, Nyawagoa, Danu, Onagiwahi.